Hello, this is Dr. Steve Horwitz. The issue of return to play, especially return to play after ACL injury, has become a very big issue, and there are many recent papers on this topic. I want to use this to emphasize the importance of the return to play decision making after any type of injury. This excellent article was written by Mick Hughes called Return to Sport Following ACL Reconstruction in Young Athletes, and Mick Hughes makes some excellent points. One, was the patient compliant to the entire rehab plan as set out by their physio, exercise physiologist, or strength and conditioning coach? Two, did the rehabilitation plan include a period of supervised jumping, landing, pivoting, unanticipated change of direction, unanticipated landing, and sports-specific conditioning? And three, was the athlete cleared to return to sport with strength tests, functional hop tests prior to stepping back on the field or court? And were these tests also passed in a fatigue state? So what I want to do is take a step back for a moment and see why there's such confusion and frankly such poor outcomes. Number one, we really need to be very careful when assessing success rates. What does success really mean? Now, this study called Anterior Cruciate Ligament Reconstruction, not exactly a one-way ticket back to pre-injury level. What does this state? It says, however, when the level of participation was taken into account, it was found that only 65% returned to their pre-injury level of sport and only 55% returned to competitive sport. This means that 1 in 3 individuals did not return to his or her previous level of sports participation, and 1 in 2 did not return to competitive sport after surgery. So again, what does success really mean? Number two, the medical world is still using time-based decision-making for return to play. This study called Patient-Specific and Surgery-Specific Factors that Affect Return to Sport and After ACL Reconstruction. What does this say? It says time after surgery is the most common criteria used to determine readiness to return to sport. Conventional clinical advice is for athletes to return to pre-injury sports participation between 4 and 6 months postoperatively. However, time-based recommendations are based in theory and do not often accurately reflect patient capabilities. Really, really important. It goes on to say that only 35 studies, or 13%, actually use objective criteria to determine return to sport readiness. So now you can start to see why there's some very big issues in this world of return to play. Now this paper, same paper, also states that at present there's no set of criterion-based measures. So we have no established return to play criteria. There's no established measures that are being used to make this decision. So even more confusion. And finally, in a very recent British Journal of Sports Medicine paper, they have a specific criteria list now for return to play. No knee pain after sport activities, no giving away or fear. This is a big issue. Go back to the video on the brain ACL connection. There's active dynamic gait pattern, symmetrical jogging, the quality of movement, and there's symmetry. This talks about symmetry here, symmetry between the injured side and the uninjured side. We have to get back to much more symmetry, or the ability of the previously injured side to equal what the quote good side is doing. And that all goes back to the paper from Mick Hughes, that you really need to be ready for this return to play decision making. So what is the final lesson here with this? One, we need to find a great therapist, coach, trainer, somebody skilled to get you through this process. And you need to be your own captain. Get all the members of your return to play team on the same page. And yes, you will have to become your own captain of this team. Take your time, Pay attention. You're the only one who really knows how you feel. And don't stop the rehab. This is something I've seen for 30 years. People get 80, 90%, and they just stop doing all the things that got them to that point. So all the strategies you use to return to play, they must be used going forward. They're going to become part of your future training program. Good luck. Dr. Steve Horwitz, Dallas Sports Academy.